This oral powder packet medication is used in combination with dietary adjustments to treat phenylketonuria, PKU, an inherited disorder. It works by helping to eliminate excess phenylalanine from the body, which can lead to brain damage if levels are too high. It is important to take this medication as directed by your healthcare provider, typically once daily. It is best to take it with food, at the same time each day. Before starting to take Sapropterin, make sure to read the patient information leaflet and instructions for use from your pharmacist. Take this medication by mouth with a meal as directed by your doctor, usually once daily. The dosage will be determined by your medical condition, age, weight, lab tests, and response to treatment. To take the medication, open the packet and pour its contents into 120 to 240 milliliters, 4 to 8 ounces, of water or apple juice. Stir well until the powder dissolves completely, 2 to 3 minutes, then drink all of the mixture within 30 minutes. If you prefer, you may also mix the powder in a small amount of soft food, such as apple sauce or pudding, and eat it right away. Do not prepare a supply in advance. If your dose is less than a full packet, ask your doctor or pharmacist how much water or apple juice you should use to mix with the dose. Mix the entire contents of the packet as directed and measure the dose using a special measuring device. Take the dose within 30 minutes of mixing and discard any unused medication. It is important to take this medication regularly to get the most benefit from it. Try to take it at the same time each day to help you remember. Make sure to tell your doctor if you do not get better or if you get worse. If you experience a runny or stuffy nose, or a sore throat while taking Sapropterin, it's important to let your doctor or pharmacist know. It's also important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. While many people don't experience serious side effects, it's important to contact your doctor if you experience trouble swallowing, throat pain, persistent stomach pain, ongoing nausea or vomiting, black stools, blood in your vomit, or signs of hyperactivity. A severe allergic reaction to this medication is rare, but if you notice symptoms such as a rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's also important to note that this is not a complete list of potential side effects, so if you experience anything not mentioned here, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Sapropterin, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss this with your pharmacist for more information. Also, let your doctor or pharmacist know about your medical history, especially if you have liver disease. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, over-the-counter drugs, and herbal products. If you are pregnant, this medication should only be used if it is clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions when taking Sapropterin 100 mg oral powder packet for the treatment of phenylketonuria. This medication may change how your other medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. Your doctor may require lab and/or medical tests, such as checking your phenylalanine blood levels, while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it when you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take 2 doses at once to make up for the missed one. It's important to store this medication at room temperature and away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you've been specifically told to do so. When this product has expired or is no longer needed, it's best to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.